Hey, it's Rob, and welcome to episode number 4 of the Patients Interview Marathon. Today's interview comes from Gabe Groothuis from out in Iowa, and I hope that you enjoy it. Before you start into watching this, I'd appreciate it if you would click the like button, click the subscribe button, and of course, hit the little bell for the notification that lets you know every time I post a new video. These patient interviews are going to be coming out every Friday for the foreseeable future. There's 137 of them. This is number 4. So without further ado, I give you my interview with Gabe Groothuis.
What is your name?
Good morning, Rob. My name is Gabe Groothuis. How are you doing this morning?
I am wonderful, Gabe. Gabe, where are you from?
Yep, I am located here in eastern Iowa, so Cedar Falls, Waterloo area.
Fantastic. Welcome to the interview marathon. I am appreciative that you're here and willing to share your story. So briefly tell me about yourself and your experiences in healthcare, if you don't mind.
Yeah, absolutely. Maybe one of your more boring guests today. So I am 24, graduated from college about 3 years ago. I work at Thrivent Financial as a financial advisor here on a team in eastern Iowa, and I've grown up just south of here, Marion, Iowa. And a lot of my experiences growing up were related to sports injuries. Was probably maybe the most notable. Playing soccer, primarily a little bit of football, a little bit of cross country, and some of my interactions with professionals there, rolled ankles, broken bones, things like that. Recently, I had a chance to go overseas to go do some mission work in Kenya, and so there was a lot of interesting interactions with medical professionals as far as getting everything you need here and then getting back and forth with COVID and everything. There was very interesting that way. So those have been some of my personal experiences with medical professionals, and open to touch on any questions you have about those.
So talk to me then a little bit about your experience from like the U.S. system versus what you were experiencing in Kenya. What were the differences? And just from a practical perspective, like how did you manage to get, like, what was the preparation you needed to have in case you were going to need any form of medical assistance while you were in Kenya?
Yeah, that's a great question. And I may be hopping ahead a little bit too to one of your other questions about who a hero that we have is. One of the gentlemen we went with is named Dr. Steve Price, and he's been a ER doctor and medical doctor down in Kansas. So we were very fortunate. We were traveling with the doctor. He'd done medical missions before. So there was certainly a level of peace knowing we had someone with us. As far as comparing the two systems, and a lot of it is probably cultural. It was a little bit shocking. Even to get back, we had to go take COVID tests in the hospitals there. There's no, at least where we were at, there was no real like lines. Kind of people just rush to wherever they want to go. And then there's very little accountability too. There was some of us who tested negative, some who tested positive. We had to kind of come home in waves, and it wasn't abundantly clear if they were testing correctly or not. A test there would cost the equivalent of maybe 180 to 200 American dollars, which is about, it could be up to 2 to 3 months worth of work for someone there. So it felt like there may have been some corruption there. So that was very, very unique. It was just stressful, I guess there, and it could be stressful here too, but there's English, but a lot of Swahili too. So the language barrier was different. So we had a lot of trust in the guys who were hosting us, the Christians there. And then Dr. Price, who was with us, whatever he told us to do, we would just do it and just trust that it would work out. But yeah.
Wow, incredible. So between your sports injuries and your experiences in Kenya and all of that, have you met any healthcare heroes these are the people who are doing it right?
Yeah, and maybe a little bit of a non-conventional answer too. I mentioned Dr. Steve Price. He's done a lot of medical missions. I've kind of worked with him more in a missional aspect, and very impressed with the way he takes care of people. But two of them that I was thinking in my life are actually both chiropractors. One is my grandpa, Dr. Glenn Groothuis in Hudson, Iowa, and then my chiropractor in Cedar Rapids was Dr. Powell. And I remember just a specific story, if I could share.
Sure.
I was playing soccer. I think it was my junior year, and we were pretty good. We were going into sub-state, and I had a pretty bad where I planted, and someone kind of landed on my ankle. And so we went to it hurt pretty bad. So we went to our provider, and they did an X-ray, and it wasn't broken. It was just rolled. And they just said, hey, you can't play sports for 3 weeks. Here's some painkillers,
Okay.
be on your way. And I, as a young kid, it was like your world is dashed. You're like, well, we have
Sure.
sub-state next week. And so I remember my parents took me to my chiropractor, and he actually did some like adjustments on my ankle. So it was about 6 days before we were going to play again. He did some adjustments, gave me some exercises. We had 2 or 3 follow-ups. But he actually listened. He didn't prescribe me anything. He actually listened to what I wanted to hear, what I wanted to say, excuse me. And I just told him, hey, it's a priority. I'd really like to play in this game. Our team is good. What needs to be done? And he said, well, here's what needs to be done. And then he shared the risks too. I mean, if you do this, it could lead to this or it could lead to this. But ended up doing the exercises pretty religiously, and I had a couple treatments with him. And then, yeah, it was great. I was able to play. I had a lot of tape on it and everything, and a splint, but it was fine. Everything went well. And so thankful for that second opinion. And additionally, when I broke my right arm, as a young guy right up here, and the doctors kind of gave me a sling. It wasn't worth doing surgery, but they ended up having to just put it like in a sling, and then once again gave some painkillers, but the muscles were all seized up, and I didn't realize that the pain was there initially, and then it kind of was just there for a long time. And my grandpa, I went up to see my grandpa, and he gave me some exercises to help loosen up, and did some laser therapy, and all the muscles right here in the shoulder just relaxed. And man, that was some relief from pain that I hadn't had for a while. And so anyway, I was very thankful for the chiropractors in my life that listened. I guess that's probably my biggest takeaway. Just listened. What's going on, and what do you want? And that was huge. It's a little intimidating being 15, 16, now 24, talking to a doctor. I don't know everything going on, but it's very comforting when a professional will just listen. So those would be some markers of a hero that I would be thankful for, someone who would listen.
Yep. I appreciate, and you're so right, because there's a number of different layers of that dynamic, right? There is the doctor patient, and then there is the kind of younger person, more experienced person. And all of that together creates a paradigm in which you're less comfortable sharing, and you're less comfortable saying like that doesn't make sense, or what
Speak
you said,
English.
right? Or even to say, I think what you just said contradicts what I heard you say earlier. All of those things are things that we're a little bit more hesitant to do. So, such an interesting thing. What does quality healthcare mean to you?
Yeah, great question. I think getting back to that piece on listening, I think in our line of work, when someone walks in the door, the first thing we want to do is ask questions. I heard your last guest. What do you hope to get out of this? What concerns do you have? What fears do you have? Quality healthcare to me is someone who's willing to listen, and that shouldn't, I don't think, just be the front desk lady. I don't think that should just be the nurse. I don't think that should just be the doc. I think that should be all areas of healthcare. And I don't know what everyone's experience is. It feels, in my experience, to be a very reactionary system. So something goes wrong, here's how we're going to react quickly to it. And there's definitely a time and a place for that. I have some family that's worked in ERs, and I'm so thankful for the people who can react, really quickly to high trauma situations. But for the in and outs, I think it's really beneficial when someone comes in with listening first. And so quality healthcare to me is more of a team mindset, not you tell me what to do and then I do it, or we'll take care of you. It's, hey, let's be on the same side here, and let's come up with ideas and solutions together. So quality healthcare is healthcare that listens.
Yeah. It is interesting because it starts with the patient. And I'll be just quite frank about this, okay? And that is, so many times it's forgotten that the only person that knows what the symptoms are, the only person that knows what the experience is the patient.
Yep.
And if you don't listen to them, you're not going to have all the information that you need in order to make an informed diagnosis, and in order to create a treatment plan that's going to work. And then beyond just listening to find out what the symptoms are so you can make the diagnosis, there needs to be an acknowledgement of what's going on in the patient's life so that the treatment plan for the diagnosis can be properly implemented. Because, if you're saying to a kid like you who's got some ankle issues, like, yeah, I mean, just take it easy and stay off your leg, stay off it for 4 to 6 weeks. Like that's a big chunk of your season. So you've got to know exactly how to do that. And so it's listening to find out what the symptoms are, and then listening to also hear what the life circumstances are.
Absolutely.
Yeah. So what do you wish your medical providers understood about you?
Great question. I really wish they would, maybe across the board understand what my purpose is. I don't hope to live just a pain-free, easy life, and sometimes I think they're so quick to prescribe something. Sometimes like, well, I'm okay living with a little, even a sickness or something. I just don't necessarily just want a bottle of pills.
Sure.
I'd like to know what's going on. And then, just like in our line of work, it's hard when people come after something really bad has happened. And that's the first time you meet someone. It's a lot easier if we plan on the other side of a catastrophe than planning right after. And so, I wish they understood that, my desire would be proactive and not just a reactive kind of treatment plans. And I really would love to view the doctor more as an advisory kind of role where they're providing advice. Hey, in your life, are you doing these things? Why are you doing things? And then educate, not just prescribe, but educate. So I wish, I don't know, I have a passion for educating people. And then when I'm in that situation, I love to be educated. Teach me like I'm 5, man. Get a whiteboard out if we need to. Get the legal pad. Just teach me. So a passion for that. You can probably tell I'm passionate about that. I would love if healthcare professionals were as well.
Okay, let me see if I can summarize what you say. And that is, you're looking for a doctor's assistance in being healthy rather than a doctor's intervention when you are sick. So, I mean, there's a difference between being healthy and handling sickness. Does that make sense?
That's pretty spot on. Yeah, absolutely. Health is not, in my opinion, well, it's just something that we think about when it's not working, right? It's good to invest in your health when it is working too. And so, yeah, you summarized that wonderfully, Rob.
Okay. Well, listen, you said that part of what we have to do is listen. So I'm trying to listen and then make sure that I understand exactly what you're saying. So, very cool. So what is one thing medical professionals can start doing today to improve the quality of healthcare?
Yeah, sorry to beat the same drum. Listen, just listen.
Okay. So, do you have a practical suggestion for that? Because a lot of times doctors, and we're beating on doctors a little bit hard today, but they have a treatment window in which they have to be in and out in 15 minutes, sometimes 12 minutes, sometimes even less than that. And do you have some ideas for how do they listen well in a short period of time?
Yeah, so open-ended questions are very helpful versus a closed-ended question. That's assuming the answer. Your ankle hurts because you rolled it right. Feels a lot different than why does your ankle hurt? And so just even the phrasing of the question, and then a great follow-up, like every 2-year-old will tell you, is why. So, hey, I'm refusing this treatment. I don't want this. Well, can you explain why you are? And that helps get you, and I don't know, that might add another 30 to 45 seconds to something, but that can be a huge clarifier. So the doctor maybe can help overcome an objection you have that's not real, but they don't know why. Then it's just like 2 cars flying by each other. You're never going to get on the same wavelength there. So yeah, that question is huge. Open-ended questions and then following up with why.
Okay. Listen, I love analogies and everything, and your analogy of 2 cars flying by each other is great, except if they actually connect, you end up with a car crash, and this is not a pretty thing, not what we were intended for. So
not endorsed.
I mean, two ships passing in the night, two cars whizzing by each other. When they connect, in the medical field, when they connect, it's a good thing. In the real world, when they connect, it's not exactly what we were looking for.
Correct. Nope. I appreciate the clarification.
Not a problem at all. Listen, Gabe, I appreciate you joining me. I appreciate your willingness to share. It's been fantastic, and I think your advice is practical and easy to implement. Thanks for being here, and I appreciate your perspective on healthcare.
Hey, best of luck with everything today. Thank you.
Thank you, buddy.